Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. And tell me what's going on with your elbow. What's happened?
Baseball, I guess I've been pitching a lot.
Okay.
My arm just started hurting.
So how much pain do you feel there from 0 to 10? 10 is emergency room, 0 is nothing.
6.
6. And is that like a considered constant pain or just comes and goes?
Like constant.
Constant pain. Where do you feel it?
Elbow.
Right here. How long has this been going on?
1 to 2 years.
1 to 2 years. And at worst, how much pain do you feel like when it's good bad?
Like 8.
8, and in the same spot.
Yeah.
What make it worse? What make it really painful?
I throw a lot.
When you throw a lot. Okay. So we're gonna do a few range of motion and see if that's aggravated. But before that, did you have any treatment for your elbow? No. Okay. So let's extend your elbow and tell me how much pain with that.
Like 5.
5, and you feel it right here?
Yeah.
Okay. What about
Like 6.
6 in here?
Yeah.
What about turning around?
5.
Okay.
Yeah, like 5 still.
So the worst range of motion is like doing this?
Yeah.
Okay, and you feel it right in there. Make sure what I'm doing is not painful. Okay, so we'll have you turn toward me. Okay, relax, relax, relax. Relax. I'm not gonna give you injection. Not now. Is it painful here? In here?
I feel like tingling.
How often do you get the tingling pain?
That does happen too when I pitch. Like sometimes.
Which fingers?
These 2.
These 2?
Yeah.
Okay. Is it tingling or it's okay?
Not too.
Mm-hmm. So most of your pain just localized here, and sometimes it's just radiated to numbness in there. Yeah. Mm-hmm. You feel this knot here?
Yeah.
Remember the scar tissue we were talking about?
Mm-hmm.
So our body has to go through 3 stages in order to heal. First stage is inflammation. Second stage is the proliferation. Third stage is maturation. So the second stage, that's when the body starts to build the scar tissue.
Okay.
And here you can feel the knot. Scar tissue, it's like you feel a knot in the muscle.
Oh, you can feel it?
And you can see my hand is just rolling over it. And I have a tools that I will show it to you. You're gonna feel it with the tool.
So he has a knot there?
Yes, you feel that knot here?
Yeah.
You feel that bump here? Okay. That's a scar tissue. Is it too much or it's okay?
Not too.
Yeah, so our muscle should act like a rubber band. When it contracts and relax, it does this. When you have a scar tissue, it's like you have a knot in a rubber band. So when the muscle contracts, it does not stretch much. Instead of stretching like this, just stop. And it's very typical for golfer elbow that you have a scar tissue in the biceps area, in here. That because the biceps are attached here to here, and when it's you have a knot, the lids shrink because you don't have room to stretch it. So especially when he does extreme range of motion and twisting, you try to stretch the rubber band that has a knot that prevent the stretching.
So is that caused because he doesn't stretch before he does exercise?
Stretches is not effective.
Oh, it's not the stretch.
It's not. Stretches, based on the studies, not really provide anything. Not even decrease the risk of injury. There is better way of decreasing risk of injury. This happen either from overtraining or not warming up enough if you have it like with a sports injury. So I'm gonna go over the proper way of warming up, and we wanna make sure he does not train.
Right.
Because if you work like practice every day without break or something like that, you're just overtraining or So I'm gonna give him some tips on how to avoid this in the future.
Okay.
And there's a couple of things we can do to actually decrease the inflammation from the training. Even if he need to train the next day, there's a couple of tricks he can do too, so his body will not, have a lot of issue with this
future.
Mm-hmm. How does that feel? What I'm doing?
It's good.
And there's a big knot here. Do you feel this one?
Yeah.
Mm-hmm. So he has several knots all over scar tissue. It's very typical with
What's typical?
throwing, So where he has a scar tissue, you will see more redness, and we're gonna feel the grinding of the scar tissue. Do you want to feel it?
Oh yeah.
Yeah, so it's going to hold here. You feel that? Grinding?
Oh wow.
That's a scar tissue. Feel this area? How nice and smooth.
Oh yeah. You can tell it.
And here. You feel the grinding? That's a scar tissue.
It's like going
Yeah. So it's like like the tool is going over a rock. So you can feel it. And you feel this one?
Yeah.
You feel that? All that scar tissue. And you will see in the skin where he has a scar tissue, it's there's redness compared to the area that there's no scar tissue.
You can feel the bumps.
Yep, that's a scar tissue. Yeah. So that's very typical with golfer elbow or tennis elbow. You feel all that scar tissue. Yeah, that should not be there. So that pulling on his elbow, and sometimes that causes inflammation. So today we'll know if he purely stuck in the proliferation stage, or he's going back and forth between proliferation and inflammation, based on his response to the treatment.
So it's really
Well, we'll know.
Oh.
I don't know yet, actually. Well, I can tell, I have an infrared camera to see how much inflammation, if he has inflammation, and where he has
So right now
inflammation.
we'll work on the muscle.
Right now I'm working on the proliferation stage to see, because he said he had a constant pain. So we'll see how he's doing with that. And you can see here, look the area that is red. Look. All of this, and here you see patches of red here.
Yes.
That's and so the other area there's no scar tissue. Here it's okay, but he start to have more redness in here.
So where it's red, that's where all the
Scar tissue, all those bumps, and you feel bumps in those areas. Yeah, I feel it too.
That's a lot.
So that's where he has a scar tissue. All of that. So the blood start to rush there. That redness should disappear 10-15 minutes. Okay. So let's do the movement now. And tell me, do you have constant pain or the pain is gone now?
3.
Okay, so 1 down to 3. Okay, let's do the twisting.
Good.
You see, that was 6. This one was 6. Okay, let's drink some
You don't
water.
feel it?
I will try it again.
Good.
Okay, let's move it again and tell me how that feels. Still feel it or it's gone?
That's gone.
Okay, let's move it around again. And let me know, do you feel any pain or it's gone?
Okay, good.
Okay, alright, so you can turn around and tell me what you think about the treatment.
It's good.
You
Now
feel-
I don't feel no pain.
You don't feel pain? That's good. Awesome. Thank you so much. Thank you. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.